Welcome back to Health Nuggets, and we are having a very informative and educative discussion about the urinary tract infection. And now, Ms. Gakuo, before we went for the break, maybe how often would you say UTI occurs?
Okay. So UTI is very common. Like I had mentioned earlier, it is more common in women than in men because of the reasons that I gave. Number two, it is when we look at statistics, 7% of the population usually suffer from UTI. When you have children or you have a kid who is taken to the hospital, either hospitalized or on outpatient basis, out of those that present with fever, 2.2 to 2.4% of these children, that is less than 1 year, present with UTI. Yeah, so it's a common infection.
And especially in women, you say?
Yes. Very
Okay.
common, yes.
Okay. And as a medic, how do you diagnose UTI?
Okay, so we usually diagnose, number one, out of taking the history. So a history of the patient, they'll tell you all those symptoms like pain during urination. They'll tell you that their urine is foul smelly or it has changed color to be cloudy. That is, it looks very turbid, or it has changed to be darker than it used to be. They'll tell you that they have abdominal pains on and off sometimes. Some of these people don't even know they have UTI because they just don't present with any symptoms. But when it comes to our part, when it comes to diagnosis, then immediately after that you have to you do physical exam on the patient. You may find that if they have urine in the bladder, which has been there for a long time and has caused the bladder to distend or enlarge, in short, then you may be able to palpate or to feel the bladder. Normally the bladder is not felt. Yeah, that is one of the signs that we'll see in this patient: fever, high fever, sometimes especially in children. And now we go to lab. We usually have lab diagnosis for UTI and imaging. Imaging is simply whatever a radiologist or radiographer does. So with urinalysis, we order a sample of urine to be taken to the lab. So it's visualized under a microscope to see whatever it is that is forming, in the sense that any bacteria or anything that is there in the urine. And also, we also do culture and sensitivity. So you get those bacteria or whatever it is, that organisms that are there, and then you match them with an drug that can be sensitive to that organism. That is one way, urinalysis. The other way, you do a full hemogram. I had mentioned earlier, anemia is a cause. It can be a secondary cause to UTI because of low immunity. So that one, and also full hemogram can also show if this person has infections in the blood, everything that's going on in this person's blood. We also do a HIV test. Persons who have recurrent UTIs, you can also suspect them to be having HIV. We also do blood. We check their blood to the lab. We check for the level of blood glucose, because diabetes can cause recurrent UTI.
So you will say HIV, you testing for HIV, is it related to the immune system of this person?
Yes, yes. When you stage HIV, if a person comes with UTI, it's usually mainly at stage 2. So they have other infections besides UTI, and they may not even know that they have HIV. That could be the only presenting symptom of this person. So you have to test for that also. You test, if a man comes to me and says, you know what, I have pain during urination, it's not really very common with men. So I'll think of maybe it could also be having sexually transmitted infections. So I test for that also. Yeah. When it comes to imaging, we usually do, you can do a pelvic ultrasound for women or even for male, and abdominal ultrasound. You can check the kidneys. I had forgotten to mention that anatomical abnormalities can cause someone to be predisposed to UTI. abnormalities of the kidneys, of the ureter, bladder. So you can do a pelvic ultrasound to check the state of the kidneys. You can do what is called voiding cystourethrogram. This is for persons who have a problem with having their urine out. Some of them because of abnormalities of the bladder or anything that has an abnormality of the urinary system. You can also do an MRI, CT scan. One of the differential diagnoses is also not brain, but bladder cancer. Yeah, that one can also cause. Yeah.
So how important would you say taking these tests is? Because for many women, I'll say they are used to going to the counter and they rely a lot on over-the-counter antibiotics. How important would you say going for this lab test is?
It's very important because I had mentioned about culture and sensitivity. So when someone has their urine tested or visualized under a microscope and then it's cultured, then we get to know if you're having a bacterial infection, what kind of antibiotic is going to respond to this. Because not all antibiotics treat UTI. So you can be going over the counter and buy medications and you're just causing more harm than good to yourself.
Maybe as a medic, you can just try and explain this to our audience. Holding your urine for long. There are some that usually think that it's a strength that they can hold their urine for long. What effect that these have to their bodies?
People need to realize that bladder is a muscle like any other in the body. You go to the gym, you do some workups. After some time, what happens? Your muscles build up. So it's the same thing. You hold urine, you don't void. With time, it enlarges because you're giving it a bulk of work to do. So it enlarges, and with enlargement, number one, you'll be urinating, but some of the urine will be remaining. And with that, it will encourage bacterial infections there. Yeah, so whenever you feel like void. Also take in water, take lots and lots of water. It helps in clearing the bacteria off. Yeah.
And now to the solution of this urinary tract infection. What's the treatment out there? There are some that are used to home remedies. What's the right treatment for UTI?
Okay, so treatment depending on the cause. So if you have a bacterial infection, we give antibiotics such as we have the most common we use is amoxicillin. We also use augmentin. We also use some other drugs we call cephalosporins. We can use them when amoxicillin is not working and all that. If you have a viral infection, then it's usually with viruses, they just clear on their own. We really don't give antivirals unless this person is positive, HIV positive, of which now the drugs that they're taking will take care of them. Yeah, but if it is bacterial, you give antibiotics. If it is candida, fungal, you give antifungals and the infection will clear. If it is an anatomic abnormality, this person has to go for surgery. So the surgeons, urologists, who are doctors who see patients who have these types of abnormalities also, they can be able to help them. So treatment depends on the cause mainly. Most of the time, it's not really treated. You just take water and it clears on its own. With pregnant women, we also screen them because urinary tract infection can cause abortions, like miscarriage. Yeah, so you have to treat also the pregnant woman. Yeah. Okay.
And maybe I'll just make this clear to our audience. I know many of them will take advantage of the drugs that you've mentioned. I know amoxicillin is used a lot by many people as an antibiotic. Please make sure that you go for tests. Yeah, don't take advantage of the drugs that Gakuo has mentioned for your good.
Yeah, it's true. And by the way, they should note that urinary tract infection can ascend. I had mentioned that it has types. So it can be lower or upper. So if it ascends to the kidneys, you might even end up with kidney failure. So it's not really a matter of you just going to anywhere and just taking the drugs without consulting a medic, a professional. Yeah.
And what are some of the home remedies that you'll say maybe you've had out there that people tend to do, and which at the end of it will be affecting their urinary system?
Well, I've had, the one that is mainly common is water. People taking water. But I've had people, what they do is, I don't know if they take baking soda to neutralize. You know, we usually give a drug, by the way, to neutralize to make the urine, alkalinization, to lower the pH. To increase the pH because it's usually lower, acidic. Yeah, so some people may use baking soda because baking soda does almost the same thing. Yeah, yeah. Some people can use ginger, I've heard, because it has anti-inflammatory properties. But I would really say if you have symptoms that I've mentioned of UTI, please just come to the hospital and get treated.
And do you use the same medication to normalize the pH?
The same medication?
Like for UTI, the treatment?
Yes, we do. We do have medications. We have a powder that usually you give to the patient, and it gets the pH higher. Yeah, it alkalinizes it.
Okay. And now, how do you prevent UTI?
Prevention of UTI, number one, good hygiene. Females use cotton panties. If you know you have a condition like diabetes, HIV, make sure it's treated or you're being on medication. And, well, don't abuse drugs like medicines, just going to the over-the-counter and just taking them without consulting. Yeah, so, yeah, that's what it is with prevention, yeah, mainly.
And now, Ms. Gakuo, what's your parting shot to your viewers even as we come to the end of the discussion?
Thank you so much. My parting shot, number one, urinary tract infection is not an STI. So if you hear someone saying, oh, I'm being treated for UTI, please, we need to demystify that thought that if someone or one of your partners or partner has UTI, that if you have sex with them, you're going to get it. That's wrong. That's a myth. Number two, I need to emphasize on treatment. Don't do self-medication. It will cause you more harm than good. Urinary tract infection can be a simple infection, which can be cleared with water, taking lots and lots of water. But it can also be as complicated as causing you a kidney infection called pyelonephritis. And you'll have to be hospitalized. And sometimes it may even cause you kidney damage. So we really need to be very careful with that. And with women, what you need to do is observe good hygiene. Remember, and I'm going to insist on this, if you have a child, during voiding or after they are voided, please wipe from front to back. Don't do it back to front. You'll be making your child suffer all the time, getting these urinary tract infections all the time, yeah. So yeah, if you have a condition that you know needs to be treated like diabetes or you need to be on medication, please do so. It will really decrease your chances of getting UTI, yeah.
Okay, thank you very much, Ms. Gakuo, for joining us today on Health Nuggets and especially for informing and educating our audience.
Thank you so much for having me, Ida.
The next time you feel like you have a urinary tract infection, during your visit to the hospital, ensure that you insist that tests are done for you to know the type of UTI that it is, the stage the UTI is, and even the medication that fits it. Because as we've heard from Ms. Gakuo, recurrence of UTI is because many of us prefer over-the-counter medication and even antibiotics without even knowing what they are treating. Because the most important thing is that your health matters. Feel free to join this conversation on our social media handles. My name is Ida Munzatsi, and that's all we had for you from Health Nuggets. Enjoy the rest of your viewing.